Thanks for watching, and let's talk about surgical instruments for mouse catheterization. Let's start by mentioning that your surgical instruments should not cause undue trauma or add time to the procedure. They should feel right and be the correct size. Remember here, we're doing surgeries on rodents, so it's important that they are sized appropriately. Your instruments should be held correctly, and if you maintain them properly, they will last you a very long time. Remember to sterilize your instruments prior to surgery and in between the surgeries with a bead sterilizer. I want to mention here that the instruments in this presentation are instruments that I've used for years and work very well for me, but hey, they may not work very well for you. Instruments are very much so a surgeon's preference. First, we'll talk about scissors. The first pair of scissors here is an iris scissors with oversized finger loops. Now sharp, and I would use these scissors for skin incision and cutting external sutures. This other pair of scissors, you can see it as a different pattern. And the reason for that is I'd like to always have two pairs of scissors that I can easily differentiate. That way I can use one externally on the skin and use one internally for tissues and sutures. That way I'm reducing the risk of a potential for contamination. These nice sharp spring scissors are going to be used for the incision on the blood vessels. Remember that if you use them for anything else, like cutting tissues or sutures, will actually damage them. Now let's go over some forceps. Our first forceps are greffe forceps. These are extra fine, they're curved, and there are 1x2 teeth at the tip, which will help in minimizing trauma to the skin during its incision. These other forceps are curved and serrated, and these are just my go-to forceps for blunt dissection and also can be used for suturing. Oh, now the Moria forceps, one of my favorites. What I like about the Moria is that they are fine and blunt at the tip, so they're perfect for any work that will need to be done around the blood vessels. Now the Dumont forceps. These are the 545 Dumont. You can see they are angled at the tip. And these will be used to hold the vessel incision when it's time to insert the catheter in the vessel. There is a correct way to hold your instruments. Let's start with the scissors. As you can see, your thumb and ring finger should be in the scissors loop. Your index finger should be on the shaft, and I will give you more control, and your middle finger should be over the loop where your ring finger is. As far as the forceps goes, it's easy. You should really hold your forceps like a pencil. Now needle holders. Oh, there's so many different types of needle holders out there, right? So, and again, this is so much surgeon's preference here. I like the Cult needle holder. It has a quick thumb release. And during the surgery, I will use this for, of course, for suturing and for applying tension on sutures. The hemostat will actually also be used for applying tension on sutures. This is a microserfin clamp that will be used to clamp the catheter during the surgery. Now a retractor can be very useful, especially when you do the carotid artery catheterizations. You can use it with an elastomer to fix your retractor in place. This instrument is called a groove director. I really like it for blunt dissection when it's time to form the subcutaneous pocket on the back to accommodate for the disc of the VAB. It works great for tunneling and to guide the catheter from your throat incision to your interscapular incision. Silk is used for ligating the vessel and to secure the catheter in place. And the reason why silk is used for these purposes is that it offers a greater knot security. If you do not have any instruments, you can get a complete kit directly from Fine Science Tools. Again, thanks for watching and you enjoy your day. Bye-bye.